100. For what reason should the patient notify his dentist regarding warfarin therapy? The answer is because of increased risk of prolonged bleeding. So think of a patient notifying his dentist about warfarin therapy because in war you bleed out. Therefore notify the dentist about warfarin therapy if there is an increased risk of prolonged bleeding. 101. What discharge instructions to give to a patient taking warfarin? The answer is, the discharge instructions to give to a patient taking warfarin are, take it at the same time every day, do not skip or stop taking it, notify the doctor of side effects or unusual bleeding, use a soft bristle toothbrush and electric razor, avoid alcohol, and wear an ID bracelet. 102. What medication would be prescribed if a patient has excessive bleeding during anticoagulant therapy with warfarin? The answer is, the medication that would be prescribed if a patient has excessive bleeding during anticoagulant therapy with warfarin is vitamin K. Vitamin K helps stop the effect of warfarin by increasing blood clotting mechanisms. Think of the K as kicking the effect of warfarin out the stadium. Vitamin K helps stop the effect of warfarin by increasing blood clotting mechanisms. 103. What effect does alcohol have when ingested by a patient taking warfarin? The answer is, the effect that alcohol has when ingested by a patient taking warfarin is, it increases the risk of stomach bleeding. So think of war in the stomach, which leaves a lot of bleeding. 104. How does heparin work? The answer is, heparin inhibits the formation of fibrin clots. 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 105. What is the most common adverse reaction of a patient receiving heparin therapy? A. Bleeding, hemorrhages, bruising. 106. What is the correct method and routes for administering heparin? A. Only given SC or IV. Place patient in supine position, place a cool compress on skin before administering, and give at 90-degree angle into a skin roll abdomen, upper buttocks, thighs, rotate injection sites, do not aspirate, and do not massage site after administering. 107. What is the action to take prior to administering heparin? The answer is, the action to take prior to administering heparin is to check the correct amount with a 2ND licensed person. So think of heparin and insulin both as those heavy drugs that you can't administer by yourself, so you need a second licensed person to be a witness prior to administering it. 108. A. Which of the following actions must the psychiatric technician take prior to administering the first dose of heparin sodium to the client? The answer is, check APPTPT and NR prior to administering. 108b. Which of the following laboratory tests must be performed frequently on patients receiving anticoagulant drugs? The answer is, the laboratory tests that must be performed frequently in patients receiving anticoagulant drugs are APTT, which is activated partial thromboplastin time, INR, which is international normalized ratio, PT, which is how long it takes blood to clot, Hemocolt, and GUAC, which is the urine and stool. 109. How can adverse reactions be managed? The answer is, for warfarin, Coumadin, increase intake. For vitamin K, avoid non-steroidal anti-inflammatory and Tylenol. So think of the FUs at war. Don't give the soldiers in warfarin, Coumadin, non-steroidal anti-inflammatories and Tylenol, and increase the vitamin K. And for heparin, think of increasing protamine sulfate for heparin, and check vitals every 2 to 4 hours. 110. At what angle to the skin is heparin administered? The answer is 90 degrees. The angle to the skin that heparin is administered is 90 degrees, so think of heparin, 90 degrees for heparin. Heparin at 90 degrees, 90 degrees for heparin. Heparin at 90 degrees, 90 degrees for heparin. Heparin at 90 degrees.